I want to talk about something that doesn't make sense, and it's costing people in New Zealand their lives. Medicines, born from public labs, university breakthroughs, taxpayer-backed grants, too often end up behind a velvet rope guarded by price. I'm talking about the gap between who pays to discover a drug and who actually gets to use it. Here's the pattern. Public money funds. The early science researchers publish a private company, licenses, it wraps it in patents, does trials, important work, and then, bam. A sticker price so high that everyday people and even governments can't get the medicine to the folks who need it. In New Zealand, we've got Pharmac, a system designed to bargain hard and keep costs sane. But bargaining only works if the other side is bargaining in good faith. When a company sets a price that would swallow a hospital's budget, it's not a negotiation, it's a standoff with patients stuck in the middle. You've seen it. Families crowdfunding for cancer treatments, parents refreshing inboxes for a ruling that decides if their kid gets a life-changing therapy. We celebrate research wins, then tell patients to wait months, years, while prices hover in the stratosphere. Let's be real. Profit isn't evil. It drives trials, manufacturing, distribution. But there's a point where profit stops rewarding innovation and starts punishing illness. When a drug's list price bears little resemblance to its R&D risk, or when the public effectively prepaid a big slice of that risk, then the math should change. Other countries have tried things, transparency laws, patent reform, for publicly funded inventions, compulsory licensing as a last resort prize, funds for breakthrough cures faster, Pharmac pathways for fair pricing. None of these kill innovation, they align it with the people who made it possible. Imagine a simple rule. If public money helped make it, public access is part of the deal. Or a clawback, price the drug like it's gold, sure. But if that price blocks access, the public can license production at a reasonable margin. Suddenly the incentive is to set a price that works in the real world. I'm not asking for miracles, I'm asking for alignment. Patients shouldn't be a revenue model, they should be the goal. New Zealand prides itself on fairness, that's our brand. So let's measure success not by quarterly earnings, but by a simpler metric. Did the sick person get the medicine? If the answer is no, the system failed, no matter how polished the annual report looks. Policy makers push transparency and public interest licensing. Companies price-like lives depend on it because they do. And the rest of us keep the spotlight on, because the cure doesn't count if you can't reach it.